Okay, so go ahead and tell me your story, your
Okay.
remembrance.
My remembrance. Well, okay, so it was 50 days after transplant, and transplant was on September 19th and 20th. So 50 days after the 20th. I had been on hydration therapy, about 1,000 mLs or a liter of fluid a day, and I had been getting more and more bloated, and just my eyes were puffy and swollen, and I had this huge amount of water in my body that was just making me feel bloated and waterlogged. And so I had been symptoms were getting worse and worse as far as being able to walk and not feeling fatigued in those 3 weeks or so. And at the clinic, they weren't recognizing it as a symptom necessarily. But then I started having some problems, and that morning on the 50th day, I woke up and was supposed to go to the clinic, get treatment, and I just told Carrie, I can't do it. We need 911. I feel like I'm drowning. I can't catch my breath. And I literally huffing and puffing. I was in pain. I didn't really recognize it for the hiatal hernia and my T6 compression fracture in my back at that time. But all of that was going on at the same time to produce a huge amount of pain. So 911 came, and they put me in the ambulance and took me to UW, and they took me into the emergency. I stayed there, seems like it was overnight, or anyway, I got into a room maybe the next morning, I think. But they treated me with fentanyl because the pain was so severe. And the fentanyl did go to the pain. It didn't do anything to relieve symptoms. And I was still in significant pain when it wore off. So I was on the fentanyl every 4 hours or whatever to try to get that going. Okay, so then they put me in a room, and they had me, I forget the level of oxygen, it was pretty high because they had trouble stabilizing me. My oxygen demand was really high. And so I was in that room for maybe I'll have to recollect and then get back to you on that. For several days. But then my condition got worse, and I had a lapse and a spell again. So they decided to put me in ICU. And at that time, everybody was flying around saying, we need to find out what it is. We need to intubate you and do a bronchoscopy and all of this other stuff. Well, that scared me because they had already warned me earlier on that when you intubate someone that possibly has GVHD or graft versus host disease or something, that they usually didn't come off ventilator. And when they say didn't come off ventilator, usually means they died that way. So